Ladies and gentlemen, we greet you all. Now, today we want to talk about hemorrhoids. Many people there are facing a problem of hemorrhoids. Bafuna ebizimba mu kabina, ze tuyita hemorrhoids. Hemorrhoids bye bizimba ebiri mu kabina. So today we are here to talk about them, to talk about these hemorrhoids, to know what causes them, what brings these hemorrhoids, what are the prevention of these hemorrhoids, what are the types we have, what causes them, what signs and symptoms that a person can be having, and you know that you're having hemorrhoids, that you're suffering from these hemorrhoids. So they are disturbing a lot of people, but when they don't know what exactly they are having. We want to see on their investigation we can do to see whether now these are real hemorrhoids and on which grade are those hemorrhoids. We want to see how can we treat these hemorrhoids and how can we prevent hemorrhoids. From today, after this session, you're going to be knowing everything that is about hemorrhoids, and you're going to be able to go through them and even to prevent them, to treat them at your home basis. But when you have them and you have treated them from your home and they are not curing, please come to my medical center. We are going to work on you very well. All contact us on this number 077 1289 792. I'll be able to help you. Come in my box, get on box can WhatsApp, talk about kuna WhatsApp awo enamba eno 077 2 9 tulabike ntuyongera ddala okugoberezganya ebintu bino tubitambuze bulungi. So olunaku lwaki twagala kulaba hemorrhoids. What is hemorrhoids? As we have seen here, that we want to know what is hemorrhoids. Hemorrhoids already tukimanyi, these are masses of dilated veins in a swollen tissue at the margin of the anus or within or nearby within the rectum. Nti hemorrhoids zino kyekizimba ekibeera mu musuwa ogumaze okugaziwa mu anus munda oba mu kabinako munda oba kungulu kuli mu kyenda kiri ekifulumya obubi. So kyekituyita hemorrhoids. So abantu bangi bazirina naye nga tebakola ki tebamanyi. So in these hemorrhoids we have different types. We have external hemorrhoids and internal hemorrhoids. Tulina hemorrhoids ez'owabweru ne hemorrhoids ez'omunda. What are the external hemorrhoids? External hemorrhoids, there's hemorrhoids oba bwe buzimba obumaze okufulumayo. Those are masses that are outside of the anus or within the dentin line oba ku line eya anus okolki buno buzimba kwe buli. Those are what the external hemorrhoids. Then internal hemorrhoids, those are hemorrhoids within the rectum, inside the rectum or nearby okusemberera ku dentin line naye nga ziri munda mu kyenda kiri ekibeeramu obubi nga tebunafuluma wabweru. So zetuyita external hemorrhoids and internal hemorrhoids. So they're totally different. So how can we know the difference between these two? External and internal hemorrhoids, those are covered by a columnar epithelial tissues in what? In the anal canal. So at least the external, those are lined by what they call squamous epithelial tissues. So ekirala nti bwe tubeera nga tulina ze tuyita internal hemorrhoids, teziri painful. So if you're having them, you will not know that you're having hemorrhoids unless you come to Manja Medical Center or contact us through that number 077 1289 792. Through the WhatsApp, you will be getting to know what you are having. So internal hemorrhoids, they are not painful. So tojjana pulya bulumi ng'olina internal hemorrhoids. But when you have external hemorrhoids, they are painful. Zo obulumi buba bw'amaanyi nnyo singa obeera ozirina. Ekyo nti zino lining nga otugambye nti zo ziri internal, ziri above the dentin line. Dentin line eno ebeera nti wali akatuli we tufulumiza munda wali gituta dentin line. Then below the dentin line, that is external hemorrhoids. Zo zibeera wabweru, kituyita ni ziri wabweru. That is the dentin line. So tulaba nti zino zo ziri embryology from endoderm. Ate zo ziri external ziva mu ectoderm layers. So mainly those are external and internal hemorrhoids. So tusobola okubyawulira ebintu ebyo ebibiri, internal na external. So ekirala nti what causes because tumaze okulaba types, tumaze okulaba zino types, tumaze okuziraba bulungi. So we want to see what causes this hemorrhoids. What really causes this hemorrhoids? Musawo nyina hemorrhoids naye tomanyi zijja zitya. Ekisookera ddala ekikozinga hemorrhoids, abantu abanene ennyo abali obese, so ogenda kufuna obuzibu buno bw'okufuna hemorrhoids. Those who are lifting heavy masses, nga bano abasajja ab'obunyama abasitula ebyuma ebyo bizitowa, bagenda mu gym musitula ebyuma ebizitowa, ebisobola okuleetera okufuna hemorrhoids. Enyumisa nti omuntu alina emyaka 45 okutuuka ku myaka 65, those aged people in between 45 to 60 and above, they are going to face these hemorrhoids. Also, it is more common in pregnant women, but it is temporary. Sometimes after giving birth, these hemorrhoids are going to go away. So when we have what we call chronic constipation or diarrhea, when we're in chronic constipation, you're going to face these hemorrhoids. If you are getting when you are that process of defecating, ogenda kubanga onyiriza obusuka buli ogenda kumalizanga obudilatinze ate nga bufunyemu masses. So chronic constipation or diarrhea can bring us into these hemorrhoids. Ekirala nti prolonged standing or sitting, kati bano ng'abasirikale abayimirira ennyo, so you're going to face this problem. Also these truck drivers, or you are driving for a so long period, ng'ovuga olugendo lunene nga bw'obeera otudde oba otudde wamba n'abasajja ababeera mu office, you're going to face this problem. Advancing age njogeddeko, when having cancer of the rectum, this is going to come. Some yafunako renal rectal surgery, ogenda kufuna ekizibu kino. Episiotomy, omukyala bwe nga bakolako episiotomy, you might get this problem. So you have to go first to your doctor, or to come to me or inbox me through my WhatsApp number, which is there, and I'll be able to answer to you. So those are mainly the causes of hemorrhoids, and if you have go through this, just anytime hemorrhoids are coming. So now from there, we want to see the signs and symptoms. We want to see the signs and symptoms of these hemorrhoids. Signs and symptoms of these hemorrhoids. If you're having internal hemorrhoids, you are going to be having painless bleeding. You are going to be seeing bleeding that is coming out of of your anus or in the feces. Bleeding, apart from having PUD, so you shall be seeing bleeding. Also, often itching in the anal region. Oyinza okuba hemorrhoids nga tumanyi niyo omuntu ng'oli oteekayo ngalo oli mu kutakula niyo ozibwako jidde dda because of this hemorrhoids. Tusobola okufuna prolapse, ekintu emmeeme oba kibaita okugwa emmeeme, ekintu kigyenda nekisookayo olw'ensonga eri ng'eriwo. Ekyo tusobola okufuna leakage of feces, bwe n'obeera n'otandika okulaba nga obubibi butandika okufuluma, obubibi butandika okufuluma. So okufuna pain in that anal area, that prolapse. That's especially nga hemorrhoids eyo efunye infection oba hemorrhoids eyo evuddeyo gyetuyita prolapse, so ofunamu that pain. So ofuna swelling oba masses at the anal area. So obonabona obubonero butulagirawo nti omuntu ono alina hemorrhoids. Now remember, this hemorrhoids is classifying, we class them into 4. We have grade 1, grade 2, grade 3, and grade 4. In grade 1, that is just we're having some hemorrhoids when it is bleeding, it's normal. We have grade 2, what we have the prolapse, but this prolapse can reduce on its own. The grade 3. Grade 3 we have prolapse, but this prolapse cannot reduce on its own, and even grade 4. And in grade 3 and grade 4, we shall see in the treatment that grade 1 and grade 4, they are treated by surgery. They do surgery on you. Different surgery can be done. If you want to know those surgery, inbox me. I will tell you what those surgery are. Then grade 1 and grade 2, those ones can be treated by either medicine or just can be treated by just conservative, just in eating and doing non-pharmacological things that can help to come out of that. So when we want to see now, how can we treat this? We said you have the conservative treatment. We have surgical treatment, and also have the non-surgical treatment. So as non-surgical treatment works on grade 1 and grade 2, then conservative also works on grade 1 and grade 2. While grade 3 and grade 4, they only worked on when we are doing surgeries. And today, I'm going to give you conservative way of doing this. Then non-surgical, we can give some medication. So here, in conservative way, you have to make sure that you get food which is high in fibers. That food, which is high in fibers will help you to treat these hemorrhoids. Another thing, you can take stool softeners. Stool softeners, take pint of water. If you're a man that is today, you have to take 2.5, at least 2.5 liters. When I say at least, ekitegeeza nti even osobola okunywa ekisukkaawo at least 2.5 to 3 liters. That's what you can take a day. So this can help you to soften the stool. Also, we can get the laxatives. Also, can help us in softening stool. Also, for proper hygiene, no beranga gwe emabega oyonjayo bulungi nnyo. Simulayo bulungi, wipingayo bulungi, waberenga watukola. So kino bye tuyamba ku preventing hemorrhoids zino. No also taking the anti-hemorrhoids pessaries. As we are zimanya, visit me in the inbox. I'll be able to tell you what to use. Now, after seeing this treatment, how can do? Then we want to see how can we prevent these hemorrhoids. How can we prevent hemorrhoids? So, in preventing hemorrhoids, you have to do these things. Make sure that you reduce on your weight. Do regular exercise. When you do regular exercise, this is going to help you to reduce and to prevent these hemorrhoids. Another thing you have to do, take pint of water every time. Be rehydrated, because if you're not rehydrated, you're going to end up having that constipation that is going to hang around. So when it comes around, it's going to cause a problem. So another thing, you complete a bowel within a few minutes of feeling that you want to go in the toilet. When you feel you want to go in the toilet, please genda mangu tolinda tebidako mukazi kennekwasa so kembulebulemu genda mu toyi bikole ekintu ekigwe ne wona alinda embeera egenda kwongera okutabukako. Another thing which you can do, make sure that you don't strain tewekaka mwogeze maanyi tosindisa maanyi ekigenda kuletera okuleeta emiswejjo okubasitinga. And your area tukikeeping ngeri clean ekijja tuyambirako ddala. Atwewala okusitula ebintu ebizitowa. Avoid lifting those heavy weights. So zigenda kuletera obuzibu obw'amaanyi nnyo. So we eat the other diet, our diet, which is highly fiber, ngerimu fiber nyingi. Kati otuwa tumaze okola prevention, we want to see what are the complications that are going to come when you get hemorrhoids. Ekisookera ddala nti bw'ofuna hemorrhoids zino ogenda kufuna pain. That is when there is a prolapse. Ogenda kufuna pain. Tugenda kufuna the annual fissure. Ojja kufuna annual fissure if you have these hemorrhoids. Tugenda kufuna urinary incontinence. This can be acute urinary incontinence. Ogenda kugifuna. Oba osobola okufuna constipation nga tosobola kufuluma bulungi olw'ensonga eya hemorrhoids. Tosobola okufuna secondary hemorrhage n'obeera ng'oggwamu omusaayi. Hemorrhage ng'olina bleeding ekubira n'omaliza ng'ofunye anemia. Ogenda kufuna anemia olw'ensonga nti ziri hemorrhoids zibleedinga naye ng'ate gwe tonaba kumanya nti zikola ki zibleedinga. So tugenda kufuna infection. Infection will come invading if we have these problems. So if you are there and you're suffering from that problem, just visit us on Mayanja Medical Center. We shall be able to work on you very well. Ojja kufunamu ebirungi bingi. Ate gwatanaba kulikinga video girayikinge gisharinge ku muntu gw'omanyi nti kimukwatako ate information naye asobole okugifuna. Subscribing ku YouTube channel yaffe Dr. Mayanja UG. Subscribing ko osobola okubeera nga buseera ofuna ebintu ebikwatagana ku bulamu. Ebikwatagana ku bulamu okupiira obulamu nga bweyagala nga buli bulungi. TikTok yaffe girayikinge ate era gifollowing. Bwekityo kigenda okubeeranga buli lunaku. Tweyanzege. Thank you for watching this video and thank you for sharing it. Thank you for loving us. Visit us on Mayanja Medical Center. We shall be able to help you in everything.